Hello dear colleagues, so today we're going to talk about a new article in 2020. The name is the retrospective analysis of dental implantation under anticoagulant treatment. So the article starts about talking about some medication, as you know, like aspirin. We already know what is the purpose of this medication, so I'm not going to explain. Two groups. First, a study group, which is a patient with anticoagulant therapy at least 6 months, and a patient with no anticoagulant therapy, which is a control group. Same protocol for every patient. And after placing the implant, suturing, they also applied a tranexamic acid with a gauze. So they did a surgery regarding of the regeneration or sinus lift. When there was a regeneration, also they released, they did some releases to elevate the flap, and there is a sinus lift augmentation. They did the lateral approach. So they did a follow-up at 7 days and 14 days. At 14 days they removed the suture. Events of the bleeding were reported by the patients and recorded and treated by their physicians. They evaluated the bleeding like this. First, no bleeding. The second is the mild bleeding, like a minor oozing from the wound incision or fresh blood clot, controlled with a compressive gauze only. And the third is the moderate bleeding requiring the hemostasis by addition sutures and compressive gauze. Remember, they only performed the surgery with the patient with the INR less than 3. From 200 cases, 72 are from the test group and 121 from the control group. 52 patients with ASA2 and 19 patients with ASA3. Here we can see the medication of each patient. We have the figure 2 is about the site of the surgery. Figure 3 in the study group, in the test group, the dental implantation with bone grafts, and immediate implantation only. 4 of the study group and 7 of the control group had a postoperative bleeding complications. Chi-square test demonstrate that there is no difference between both groups, so they have the same risk of bleeding. Limitations: retrospective study, the second one, low number of cases had to do a procedure like regeneration. So with their limitation, they conclude that no alteration of anticoagulant therapy is needed prior oral surgery. Patient under anticoagulant therapy can be treated on outpatient basis without any risks. Thank you and see you next time.